I'm Jen Kessee here at Pelvic Health and Rehabilitation Center in Westlake Village. I'm going to be taking you through a series of exercises for core stabilization that you can be doing as part of your home exercise program. For each exercise in this series, I recommend starting with 2 sets of 10 reps and then progressing towards 3 sets of 10 reps as your body feels able to. But I would also suggest consulting with your personal physical therapist before trying these at home. The first exercise in this series targets the transverse abdominis muscle. This muscle runs from one hip bone to the other, spanning the entire lower abdomen. To do this exercise, find a comfortable position lying on your back with your knees bent and the soles of the feet flat on the floor. Then bring your hands just inside the hip bones. Good, a little bit more inside. Good. And you can actually use just 2 fingers. A little bit higher. Good, right there. To feel this muscle contract, take a deep inhale, filling the abdomen. And as you exhale, draw the belly button in towards the spine. That looks good. And a reminder is we are not sucking in the belly, but rather using this muscle, the transverse abdominis, to contract and draw the belly button towards the spine. Do this for 10 reps, then take a short break, about a minute, and then repeat for 1 more set of 10 reps. The next exercise in the series is the pelvic tilt. To do a pelvic tilt, start lying on your back with your knees bent and the soles of your feet flat on the floor. Place your hands over your pelvic bones and then draw the pelvic bones towards your feet. Here you will notice a little bit of arching in the back, and then draw the pelvic bones in the opposite direction towards your head. Here you'll notice the spine imprinting on the surface beneath you. So our model has great form because she's keeping her hips flat on the mat and not lifting them up in a bridge. You may notice some light glute activation when the pelvic bones draw towards the feet, and some light abdominal activation when the pelvic bones draw towards the head. Do this for 10 reps, and then take a short break before doing your next set of 10 reps. The next exercise in the series is a modified side plank. We'll be incorporating the transverse abdominis activation that we introduced earlier. To start this exercise, lie on your side with your knees bent and a straight line between your shoulders and your knees. When she raises her hips, her head will be in a neutral position with a slight chin tuck, and there will be a straight line running from her neck to her pelvis. To activate the transverse abdominis, draw the belly button towards the spine, and then raise the hips up off the table. The amount of time you'll hold this exercise will depend on your strength and endurance, but you can start with 5-second holds and gradually progress your way up to a minute. Then repeat on the opposite side, and it's okay if the amount of time you're able to hold in each side is different. The exercise Quadruped Thread the Needle works on opening the chest and improving mobility through the upper spine. To do this exercise, start on your hands and knees with your hands beneath your shoulders and your knees hip width beneath your hips. Inhale, raising the left arm up, opening the chest, and then exhale, rotate and thread that arm through. Good. Inhale back up, doing this as a continuous motion for 10 reps. And on your last rep, you can pause, and if you're able to, you can lower your head and or your shoulder down towards the floor. Holding this for 5 seconds up to 30 seconds before doing the other side. Coming up to do the opposite side, inhale the right arm up, opening the chest. Exhale, rotate and thread that arm through. Inhaling up and exhaling through. And again, on your last rep, you can pause and hold this down position with the head and shoulder resting on the floor. For our spinal segmental mobility series, we'll be doing 3 exercises which improve mobility throughout the spine. These exercises will include flexion and extension, side bending, and rotation. To do the flexion and extension, start with a nice erect posture. That means your shoulders are over your hips and your ears are in line with your shoulders. Gently tuck the chin, rounding the spine segment by segment, and then tilting the pelvis posteriorly. Once you've gone as far as you can, you'll inhale and initiate an anterior pelvic tilt, rolling the spine and extending the spine as you come back up. And if you're able to, you can gaze towards the ceiling. To perform side bending, put your left arm out to the side, inhale the right arm up overhead, and gently bend over towards that left side. Once you've gone as far as you're able to, inhale back to center and switch your arm position. Right arm drops down, left arm raises up towards the ceiling and bending over towards the side. Coming back to center. To perform rotation, you'll cross your arms over your chest and then inhale, turn and look over one shoulder, getting as much motion as you can through the spine. Good, we're wanting an equal distribution of motion throughout the thoracic, so this upper part and the lumbar spine. Exhale, return to center. Inhale, rotate to the opposite side. Exhale, return to center. For each of these exercises, you'll perform at least 1 set of 10, but you can progress up to 2 or 3 sets of 10 if it feels good for you. This is a great way to wake up your spine early in the morning. The next exercise in our series is Quadruped Hovers. To do this exercise, start on your hands and knees, with your hands beneath your shoulders and your knees beneath your hips. Tuck your toes. Activate the transverse abdominis by drawing the belly button towards the spine. This helps you maintain a nice neutral spine. Now raise the knees up off the table about 3 inches. Hold for 3 seconds and then lower. Repeat this 9 more times for a set of 10. Take a break and you can work your way up to 2 to 3 sets of 10 as your body allows. The last exercise in our series is a modified plank. To do this exercise, start out on your hands and knees. Then walk your hands forward about a foot. Lower your elbows down so you're on your forearms and your elbows are just beneath your shoulders. Good. Now lowering the hips, contracting the transverse abdominis so the belly button draws into the spine. You have a nice neutral spinal position from your neck to your pelvis. Making sure not to round through the spine, drawing the shoulder blades back and together. To start, you can hold this exercise for 5 to 10 seconds and then gradually work your way up to a 30 or 60 second hold.